My dear doctors, welcome to Kids Covery. Myself, Dr. Parv. We are discussing immunodeficiency diseases, and this is IgA deficiency. Now, for those of you who studied microbiology so well from your microbiology teacher, they must be knowing that IgA is called as mucosal antibody. Now, what do you mean by mucosal antibody? See, wherever you have got mucosa, okay, wherever you have got mucosa, you have got epithelium, and epithelium has got mucosa, submucosa, muscularis layer, then adventitia. So mucosa is present wherever there is epithelium. So what happens is this IgA, immunoglobulin A, is a mucosal antibody. That means wherever the mucosa is there, wherever mucosa needs, actually IgA will be there. Okay, so the definition is that IgA deficiency is a selective primary immune deficiency resulting from the failure of differentiation in IgA positive B cells. So there is no IgA positive B cell which is getting formed. So IgA is always, at the first position, it's the first alphabet. So the most common primary immunodeficiency amongst all primary immune disorders is IgA deficiency. IgA deficiency. Why? See, the anti-IgA antibodies may be present in the form of IgG or IgE. So what is happening? Your body is going to synthesize IgG or IgE, which are going to attack IgA, and that is why these are called as anti-IgA antibody. So this is a antibody which is formed against the other antibody. So wherever there is mucosa, there the infections are going to grow because IgA is not there, like for example GI infections, respiratory infections. Again, your skin is also going to have epithelium. So what is going to be there? Allergy, okay, urticaria, dermatitis. In respiratory system, conjunctivitis, asthma, rhinitis, all these things are going to come. So how to remember? Remember, mnemonic is UBERCAR. So what is UBERCAR? U for urticaria, and CAR is C for conjunctivitis, A asthma, rhinitis, okay, or UBERCARD, D for dermatitis. Okay, clear? Now up to 90% of the patients are asymptomatic. 90% of the patients are asymptomatic. Why asymptomatic? Because there is no inflammation which is going to happen. So there will be no feature which is going to come. Okay. So when you will check the serum, what is going to be there in the serum? There will be decreased IgA levels with normal levels of IgG, IgM, Ig. This is the most important thing to know. Whenever they'll ask you a question, they'll surely give you this. Okay, they're surely going to give this. Coming on to the management. So please understand that first of all, we have to manage what is the issue. So issue is the infection which is occurring again and again. Okay, so issue is the infection which is going to get again and again. So that's why we have to give antibiotics. Okay, so we have to give what? Patients with recurrent infections have to give antibiotics. We have to give antibiotics, and if still the problem persists, we have to give intravenous immunoglobulins from outside, and specifically immunoglobulin A is something which is supplied from outside. So in fact, for all the immune diseases, the treatment is IVIG and the prophylactic antibiotic which you have to give. So this was again a small video, but I've tried to cover whatever is important for IgA deficiency. Thank you so much. God bless you.